Alrighty, hello everybody, my name is Brandon Diaz and I'm going to be going over vitamin D supplementation and type 2 diabetes. Okay, I'm going to outline what is vitamin D. So vitamin D is a fat-soluble vitamin that has various roles in bone health, immune function, and insulin sensitivity. It can be acquired through the sun, diet, or supplementation. Vitamin D2 or ergocalciferol is less effective than vitamin D3 at maintaining vitamin D blood levels, and it's mostly found in plant-based foods. Vitamin D3 cholecalciferol is usually made in the skin due to the sunlight, and 1,25-dihydroxyvitamin D is the active form. So deficiency in children can cause rickets, and in adults it can cause osteomalacia. Toxicity can include hypercalcemia or hypercalciuria. And here I have a picture showing different food sources, so milk, sunlight, eggs, mushrooms, pork, beef liver, ricotta cheese, sole or flounders, and usually enriched cereals. Here I went ahead and kind of put the established parameters for vitamin D supplementation. So I went ahead and highlighted the populations of interest for the next 3 studies, and it was provided by the National Institutes of Health Office of Dietary Supplements. Alrighty, so what is type 2 diabetes? So this is a chronic metabolic disorder where the body is insulin resistant and hard to maintain blood sugar levels. This condition involves the pancreas, which fails to keep up with the glucose demands, and insulin production may be reversible with early lifestyle modification. So common metabolic measures include HbA1c, insulin, triglycerides, glucose, and blood pressure as a physical diagnosis. And so here are the symptoms of type 2 diabetes. So increased thirst, unexplained weight loss, increased hunger, fatigue, slow healing of the wounds, numbness in hands or feet, and blurred vision, frequent urination, and dry skin. Alrighty, and here I went ahead and showed 3 different tests to diagnose people with no diabetes, prediabetes, or diabetes type 2. So we have the hemoglobin test, the fasting blood glucose test, and the OGTT test, or the oral glucose tolerance test. So I went ahead and highlighted type 2 diabetes. So usually they have 6.5% of the hemoglobin or more, and fasting blood glucose is usually 126 milligrams per deciliter, while OGTT is usually 200 plus milligrams per deciliter. Okay, so here's the PICO question. So in adults older than 30 years old, does supplementing vitamin D 4,000 IUs per day compared to placebo lower metabolic risk factors of type 2 diabetes like HbA1c, glucose, or triglycerides? Alrighty, so here is a TRAP chart. So addressing timeliness, relevance, authority, accuracy, and purpose. So the first article by Angeletti et al. 2018 was published in 2018, and it's relevant for vitamin D use in diabetes type 2. People with type 2 diabetes and vitamin D on glycemic control was the relevance, and the authority is published in Journal of Endocrine Society, a peer-reviewed journal. The accuracy is a double-blind randomized placebo-controlled clinical trial, and the purpose is to determine metabolic benefits of vitamin D in type 2 diabetes. The next article, Pittis et al., was published in 2019, one of the largest trials for diabetes prevention, and it addresses prevention of type 2 diabetes, published in the New England Journal of Medicine, a peer-reviewed journal. And it was also a randomized double-blind placebo-controlled clinical trial, and the purpose was to evaluate preventative measures of type 2 diabetes. And the last article was Omidian et al. At 2019, so that's when it was published, and it has clinical relevance because it focuses on vitamin D and depression with type 2 diabetes. It was published in Diabetes and Metabolic Syndrome, a peer-reviewed journal source, and the accuracy is that it is a randomized placebo-controlled double-blind clinical trial. And so the purpose was to evaluate mental health effects of vitamin D in type 2 diabetes. Alrighty, so here is the article Vitamin D Supplementation in Patients with Type 2 Diabetes, the vitamin D for established type 2 diabetes, the DDM2 study, and it was done by Angeletti. Here are the results of the study by Angeletti 2018. The purpose was to determine if vitamin D improves beta cell function and glycemic control in type 2 diabetes patients. It was a randomized double-blind placebo-controlled trial. It had 127 adults with controlled type 2 diabetes or used metformin. The outcome measures included C-peptide insulin secretion rate, HbA1c, insulin sensitivity. The interventions were 4,000 IUs of vitamin D supplementation for 48 weeks versus placebo. The results showed no significant changes in insulin secretion rate or HbA1c. Strengths of this was that it was a credible study from the randomization, it used high-dose vitamin D, and it was a long duration, and it had good adherence and retention. Limitations can include many participants had well vitamin D baseline due to some of them being on metformin, and the bias could include the funding source from the USDA Agriculture Research Service. Here is the next article. It was vitamin D supplementation and prevention of type 2 diabetes by Pettis. Going over the results of this study, so Pettis et al. Was 2019. The purpose was to test vitamin D supplementation and prevention of pre-diabetes to type 2 diabetes. The study was a randomized double-blind placebo-controlled trial. It had 2,423 adults with pre-diabetes, and the mean was BMI of 32 kilograms per meter square. The outcomes included fasting plasma glucose, 2-hour post-load plasma glucose, glycated hemoglobin, and serum vitamin D levels. The interventions include 4,000 IUs per day for 2.5 years versus placebo. The results showed no significant reduction of diabetes occurring. And so the strengths of this study include that it's a credible study from the randomization, uses high-dose vitamin D, included pre-diabetic criteria, and many measurements were taken, long steady duration. Limitations include no statistical significance, sufficient baseline vitamin D levels at baseline, long follow-up period of 2.5 years, which may reveal later harm, and it included people with vitamin D deficiency, which may not show benefits in type 2 diabetes reduction. Bias could be from the funding source, American Diabetes Association, to Tufts Medical Center. So here as the next slide, this one is Article 3, Effects of Vitamin D Supplementation on Depressive Symptoms in Type 2 Diabetes Mellitus Patients, Randomized Placebo-Controlled Double-Blind Clinical Trial by Omedian. So here, this was the study, Omedian et al. 2019. The purpose was to evaluate vitamin D on depressive symptoms in patients with type 2 diabetes. It was a randomized double-blind placebo-controlled trial. It included 68 patients with type 2 diabetes and mild to moderate depression. The outcome measures include back depression scores, HbA1c levels, insulin levels, triglycerides, HDL, LDL, serum vitamin D levels. And the intervention was vitamin D3 at 4,000 IUs per day for 12 days versus placebo. So the results, depression decreased in experimental group. It improved HbA1c, insulin, and triglyceride levels. So strengths include the homogeneity of the population. It was a small number, double-blind, randomized placebo-controlled study, and valid depression and serum measurements were used. Limitation is that because it's a small sample size, it might not be generalizable to the public. It was also a short duration, and results may not help with severely depressed people. Bias is that it was a self-reported depression score. It could have subjective bias. And also the funding source of Tehran University of Medical Sciences and Health Service. Alrighty, so here's the conclusion. Some metabolic markers such as vitamin D deficiency are improved, but no direct correlation between insulin sensitivity, lipid levels, HbA1c, or glucose control. Vitamin D does not have consistent metabolic effects on preventing or reducing type 2 diabetes, and supplementing patients at 4,000 IUs per day is safe and tolerable. So just as a side note, the last article mentioned that vitamin D can help with mood symptomology. And to answer the PICO question, in adults older than 30 years old, does supplementing vitamin D 4,000 IUs per day compared to placebo lower metabolic risk factors of type 2 diabetes like HbA1c, glucose, or triglycerides, and particularly those who are vitamin D deficient or have mood symptomology or early stage metabolic dysfunctions. There may be modest improvements in some markers like triglycerides and insulin levels, but these studies indicate that vitamin D alone will not impact people with type 2 diabetes or impede it. So future research may indicate individual vitamin D deficiency and glycemic control, or vitamin D supplementation, possibly enhancing the usage of metformin. Okay. And so here's the clinical application. So patients should screen for vitamin D deficiency, consider checking glycemic control, diabetes, or depression. Check other medications that the patient is on to not cause counter interactions. Continue to educate the patient on diet, exercise, blood sugar, glucose control, and mental health. And it's important to co-manage with patient's primary care physician to track HbA1c, fasting glucose, and lipid profile through serum tests. And here's a picture of what blood monitoring system, or blood glucose monitoring system, may look like. Alrighty, here are my article citations. Here are my image credits, and if there's any questions or anything, please reach out to me.